Welcome to the deep dive. Have you ever gone to fill a prescription and found it delayed, stuck waiting for insurance approval?
That sort of limbo feeling.
Exactly. It's
Yeah.
that moment of what's actually going on here. So today, we're getting into that whole process.
Yeah.
Prior authorization for prescriptions.
It can feel pretty opaque from the outside.
Totally. Our mission here is to take our source, the prior authorization for prescriptions, a doctor-patient guide, and really dig in. Not just the steps, but, why it exists, where things can get tricky.
And what you can maybe do about it.
Right. Trying to make it a bit clearer, give you some practical knowledge if you run into this.
Good goal.
Okay, so let's start broad. Prior authorization, PA. As people get the basic idea, right?
Mm-hmm.
It's your insurance needing to give a thumbs up before you get certain meds.
Correct. It's a pre-approval.
But the interesting part is why? Why have this whole layer of, let's be honest, bureaucracy?
Well, what's fascinating here, and the source points this out, is that it's presented as being about safety and cost effectiveness. Making sure the drug is necessary for you fits the plan.
Makes sense on the surface.
But it's also very much about utilization management. Insurers use it to steer prescribing towards their preferred drugs, often cheaper ones.
So maybe not just the best drug, but the best covered drug.
Sometimes, yeah. And it can get complicated with things like manufacturer rebates influencing which drugs are preferred. It's not always just about the lowest price tag or pure clinical need.
Okay, so it's a mix of clinical judgment and, well, financial plumbing behind the scenes.
Pretty much.
That helps explain the why. But let's talk about the how. Walking through the actual process step by step, I think that could really help demystify it for people.
Definitely. Seeing the path it takes.
So it kicks off with your doctor, right? They decide you need Med X. What's their immediate next step?
First thing, they, or usually someone on their staff, checks if MedX actually needs a prior authorization under your specific insurance plan.
Right, because not every drug does.
Exactly. But if it does, well then the process formally begins.
And what does that look like? Just send a quick note.
Oh, definitely not. They have to put together a pretty detailed request. It's got your info, the specific drug details, name, dose, how long you'll take it.
Okay.
And crucially, the reason why this drug is necessary for you, often including supporting documents like lab results or maybe notes on what else you've tried that didn't work.
So it's building a case, essentially.
You could say that.
Yeah.
And the source actually mentions something interesting. A lot of initial denials aren't even about the medical need. They're due to silly things like typos, missing info.
Oh, wow. So basic paperwork errors can derail the whole thing.
Annoyingly often, yes. It turns into a documentation challenge.
Okay, so the doctor's office bundles all this up. How does it actually get to the insurance company? Email.
Usually these days, it's through secure web portals. Makes it easier to track.
Okay.
But you still see fax being used sometimes, surprisingly.
Really? In this day and age?
Yep. And if it's super urgent, maybe the phone call can happen, but portals and fax are more common for the standard process.
Right. And then it lands. Where? Who looks at it?
It goes to the insurance company's utilization management, or team. Could be nurses, pharmacists, sometimes doctors.
And they're checking? What exactly?
A few things. Is this drug covered on your plan at all? Does the reason your doctor gave match the insurer's criteria for medical necessity?
Their own internal rules, basically.
Exactly. And very importantly, have you tried other, usually cheaper or preferred medications first? That's called step therapy.
So you have to try drug A before they'll even consider drug B.
Often, yes. That's a big part of their review. It's where those internal policies really impact your prescription.
Okay, so they review all that. Then what? What are the possible outcomes?
Well, there are basically three paths. One, it's approved. Great.
The ideal scenario.
Two, it's denied. Or three, they need more information to make a decision.
Okay. And how do you find out? Does the insurance company call you?
They notify your doctor's office. That's the main channel. Sometimes, depending on the insurer and the situation, you might get a notification too, like a letter or an update in your online portal.
But the doctor definitely finds out. How long does that usually take? Are we talking hours, days, weeks?
It varies. For urgent requests, like if you're in the hospital, it can be within hours, supposedly. For standard requests, it's usually, a few business days, maybe 2 to 5 days is typical.
Still, a few days can feel like a long time if you're waiting for medication.
Absolutely. That waiting period is a major source of patient anxiety, no question.
Okay, so let's follow the paths. Path 1, approved. What happens then?
Pretty smooth sailing, usually. Your doctor's office gets the approval. They let you know, they send the prescription electronically to your pharmacy.
And you just go pick it up, covered by insurance.
Correct. The pharmacy sees the approval is linked to the prescription.
Okay, easy enough. But path 2, denied. That's where it gets sticky, right?
That's where it definitely gets more complicated. Yeah. Your doctor's office gets the denial, and it should come with a specific reason why.
Being the operative word.
Well, sometimes the reasons can be a bit vague, but there's supposed to be a clear explanation. You, the patient, should also receive notification of the denial and the reason.
So what can the doctor do then? Just give up?
No, not usually. They have options. They can appeal the decision. This often involves providing more clinical information, maybe explaining why the preferred alternatives aren't suitable for you.
Like a second try.
Exactly. Sometimes it involves what's called a peer-to-peer review, where your doctor actually talks on the phone with a medical director at the insurance company to discuss the case directly.
Okay.
Or the doctor might discuss alternative medications with you, ones that are covered or don't need PA.
And what about the patient? Can you do anything if it's denied?
Yes, absolutely. You also typically have the right to appeal the decision yourself directly with the insurance company.
Oh, interesting.
And you should definitely talk to your doctor about the denial, understand the reason, and discuss the options, whether that's appealing or trying something different. Your input matters.
So you're not just passive in this. You can be involved in figuring out the next step.
You really should be, yeah. Active participation can make a difference.
Okay, this whole thing, it really sounds like it has a lot of potential friction points, lots of moving parts.
That's a good way to put it.
So thinking about the listener, what does this all mean practically? Our source had some advice, right? Tips to maybe help things go a bit smoother.
Yeah, definitely. And some of it comes back to technology.
How so?
Well, if your doctor's office uses electronic prior authorization systems, EPA, that are integrated with their electronic health records, that's a big plus.
Why? Because it's faster.
Much faster, generally. It can pre-populate forms, flag potential issues up front, and track the request electronically. It cuts down on manual work and potential errors.
Okay, so electronic systems are key. What else?
Preparation. On the doctor's side, making absolutely sure all the required paperwork, all the supporting documents, lab results, notes on past treatments, making sure it's all complete before they hit send.
Right, avoiding those simple errors we talked about.
Exactly. Getting it right the first time prevents that frustrating back and forth asking for more info. It streamlines things significantly.
That makes sense, almost like front-loading the work.
Precisely.
What about from the patient's side? Anything you can do proactively?
Yes. A really good tip is to try and understand your own insurance benefits before you even get to the point of needing a specific prescription, if possible.
Like, know your formulary, what drugs are covered.
Yeah, check your plan's formulary online, see if drugs are on different tiers, which affects your copay. Understand your deductible. Just having a basic sense of your coverage can prevent surprises down the line.
That's a great point, sort of a know before you go approach.
It really helps manage expectations and maybe even informs the conversation with your doctor about medication choices.
Okay, so know your plan. What if the PA process is already underway and the insurer asks for more information?
Responsiveness is critical there. If the insurance company needs clarification or extra documents, making sure your doctor's office, or sometimes even you, if they contact you, gets that back to them quickly is vital.
Don't let it just sit there.
Right. Delays in responding just stretch out the whole timeline. It's about keeping the momentum going. It shows active engagement.
And finally, what about just managing the wait?
Yeah, that's important too. The source emphasizes patience and communication. Understand that delays can happen even when everyone does everything right.
It's not always someone's fault.
Not always. So staying patient but also keeping in touch with your doctor's office for updates is key. Open communication helps manage the frustration and ensures everyone's aligned.
Okay, so let's try and wrap this up. To summarize this deep dive, prior authorization isn't just a simple yes-no. It's this structured process.
Driven by both clinical and financial factors from the insurer's side.
Right. And while it can definitely be a source of frustration and delays, understanding how it works, from the doctor submitting the request to the review and potential appeals.
And taking those proactive steps, like understanding your benefits and ensuring complete information.
Can genuinely make a difference in how smoothly it goes for you. It gives you a bit more agency.
Absolutely. Knowledge helps navigate the system.
So maybe a final thought for you to chew on. Knowing now about these layers, this whole process behind getting approval for just one medication, Does that maybe change how you think about advocating for yourself?